Namaskar, I am back. Dr. K K Aggarwal, President Heart Care Foundation of India and Confederation of Medical Association of Asia and Oceania. You are watching Med Talks with Dr. K K Aggarwal, 7 p.m. show every day on digital media. This is going to be 28th episode and special COVID edition. Before I go to the subject of the day, let's have the headlines. National Digital Health Mission announced yesterday by the Prime Minister has already been rolled up on a pilot mode in 6 union territories. Russia has already started production of COVID-19 vaccine. They had promised and they have completed their promise. The positivity rate in Delhi is 7%. That means for every 100 samples tested, 7 are COVID positive. I take it other way around. For every 100 tested, 93 are not COVID. That means the time has come for us to also think of a differential diagnosis where COVID now will be only one of them. Once India gets vaccine, COVID warriors will be the first one to get the dose. That's what the committee is talking about it. Both the Prime Minister and the Delhi CM says will not open schools unless fully convinced. All over the world, there is a debate, and we are very much clear in our mind that no political party, no government will be able to take a stand. Ultimately, the matter will go to the Supreme Court, and the Supreme Court will intervene and decide based on the experts' opinion. Let's go to the topic of the day. Vitamin D, vitamin D, and vitamin D. Surya Upanishad talks about that we need a sunlight at least 3 times in a day. That is at sunrise, sunset, and during the midday between 10 o'clock to 12 o'clock. We started omitting the middle time. We started omitting the evening time. Evening time remained only with Chhat Puja, and the morning time only remained with the Magh month, the Vaishakh month, and the Kartik month. 3 of the Purnimas are called Shahi Snan, which indicates that 40% of your body should be exposed for 40 minutes and for 40 days in a year to get adequate vitamin D. Impossible today. Impossible today. With lockdown, further impossible. Continuing lockdown, further impossible. 70 to 90% of the Indian population is already vitamin D deficient. Pregnancy, matter of concern. Newborn, 400 international units, people are not getting. That's a requirement. In adults, we say that there is a requirement of 2,000 units, international units every day, and still the population is vitamin D deficient. And we know that vitamin D is necessary because vitamin D deficiency can worsen respiratory infections. Therefore, in COVID-19, there is a definite role of vitamin D supplements. There are protocols going on. Some people say give it 2,000 units per day, and others believe in a high dose. They say give zinc high dose, 75 to 100 milligram, and then they say give vitamin D 60,000 units for 3 days, followed by 60,000 units per week for 8 weeks, and then continue the maintenance dose of 60,000 units per month or 2,000 units per day. To talk more about it, I have with me an expert. Let me introduce the expert today. I have with me Dr. Rajiv Kovil. He is the Medical Director and Consultant Diabetologist, Dr. Kovil's Diabetic Care Center. He is a Consultant Diabetologist, Nanavati Super Speciality Hospital, SL Raheja Hospital, KLS Hospital, Arogya Nidhi Hospital, BSES hospitals, and whatnot. He's a founder member and secretary of the United Diabetic Forum, and he's on the field. He is a teacher and on the faculty for diploma in diabetology, and he has been a principal investigator on many clinical trials. Welcome, Rajiv, to be here on our show. First of all, when I say Indian population is vitamin D deficient, and on the contrary, we say in India we are exposed to sunlight to a large extent. Why this dichotomy?
At the outset, let me thank MedTalks, Dr. Aggarwal, IJCP for having me here. Fantastic opportunity. So fantastic question because India is considered a tropical country and people believe we are full of sunshine. And the other part of it, the dichotomy of the issue is that we have vitamin D deficiency. It's probably related to majority of us do not expose ourselves to sunlight. The amount of pollution around India, which fortunately during this lockdown has gone down, does not allow the ultraviolet B rays to actually touch skin and then convert into the active vitamin D. Plus, most of us are dark skinned, and the high melanin content also does not allow the initial enough synthesis of vitamin D. So probably all put together, data suggests that almost 80 to 90% of Indians are deficient or insufficient in vitamin D. And this is a growing problem and something we need to actually take care of.
So, do you think that amongst the medical professionals, doctors, nurses, paramedics, the deficiency is much more because most of them are indoor, they don't even see the sunlight, forget about going out, and there are large number of data available. What are your experience amongst the medical professionals?
Agree with you, sir. With your rich experience, also, you would say that yes, people who remain indoors continue to remain vitamin D deficient, and now during this phase where you are in lockdown, again it becomes a hindrance. Secondly, the exposure to sunlight is supposed to be at a time when your shadow is smaller than your height, and that typically is between around 11 to 1 o'clock and at least half an hour of exposure, which none of people who are executives or clothed people who are going into offices are not exposed to, as compared to a rickshaw puller or a farmer who's working in the farm. He may be having adequate amount of vitamin D as compared to the white collared executive who goes to office and does not expose him to sunlight all through the day and even on weekends as such.
हमारे वेदों में बड़ा क्लियर कट लिखा हुआ था, जैसे मैंने पहले भी कहा कि माघ के महीने में सुबेरे सुबेरे धूप में जाओ, वैशाख के महीने में जाओ, कार्तिक के महीने में जाओ, probably because they knew that a time is going to come. If you expose 40% of your body to sunlight, somebody will make an MMS. So therefore they said, go to near a river and expose yourself to the sunlight. Impossible today. The rivers are not there. Say if I take an example of in Delhi, the Yamuna is not there. And if you expose yourself 40% of your body to sunlight directly, not through the glass, I think your MMS will go round the clock. So therefore the answer is supplementation, supplementation, supplementation. You're taken to that.
Absolutely. I think children are no longer playing in grounds. They are addicted to devices. People do not move out. There is a car which picks you at the entrance and leaves you at the entrance. And this whole uh, westernization of India, which has occurred in the last 30 to 40 years, has actually contributed to the vitamin D deficiency. And till a few years back, till around 30, 40 years back, we only thought of vitamin D related to bones, rickets, and osteomalacia or bone density. But aaj hame pata hai, which I'm sure we're going to discuss, is that there is multi more facets to this vitamin D. It's a prodrug, it's a hormone, it's an endocrine hormone, it is a micronutrient. So many things are evolving about vitamin D. And again, this whole pandemic which has threatened mankind actually has thrown up so many new things that will take up in the future as well.
So when I talk about vitamin D, we agree that we need a supplementation. And we also know that the dose is 60,000 units per month. And we also know that in acute stage, the dose may be on the higher side. But coming back to the COVID-19, which is a multi-systemic inflammation. It's no more only a respiratory disease. It's a multi-system disease, and we have seen them in pediatrics actually developing a multi-system inflammatory disease.
Absolutely.
So when we know that multiple systems are involved, including small intestine in 50% of the cases where calcium is absorbed, so therefore, how vitamin D interacts with COVID physiology and pathophysiology, specifically respiratory and non-respiratory.
Yes. So I'm going to take a minute more. Immunity is not something that we actually looked upon. Immunity is something that we need to develop by having a good lifestyle, eating right, and exercising right. COVID-19 has exposed that we are immunodeficient, and there needs to be doing something needs to be done. So our immunity is like a radar. It looks at what is foreign to our body, and then it mounts a response. It is like a border security force on our border, and whoever tries to enter, we are trying to prevent it. Now, these radars or borders require a lot of infrastructure of lines and communications and all this. That is what vitamin D provides. Today's understanding in this 6 months of pandemic has told us that vitamin D has a immunomodulatory role. That means it can change our immunity a little bit. It increases the immunity. It increases the T helper cells, which helps in fighting out these entrance of these viruses. Secondly, it has an anti-inflammatory role. That means the inflammation, or what we in medicine we call a cytokine storm, which leads to the problems which are associated with COVID-19. So it causes an anti-inflammatory. Also, it reduces the replication, that is the doubling or the multiplication of viruses in the lungs. So vitamin D has an endocrine setup. Vitamin D in the cells of the body plays the role of these smaller units or wires which links to the radar. So it is all linked to our immunity, to our inflammatory cascade, to a system which identifies or prevents viruses from entering our body. So vitamin D has a multifaceted role today, and today it has emerged as one of the things. It is not a magic bullet. It is not a vaccine. It is not a magic bullet that you take vitamin D and you will prevent COVID. But the longitudinal and latitudinal studies globally, especially in Europe and in countries in the US, have said that wherever there is vitamin D deficiency, the prevalence of COVID has been high, and the adverse events following COVID has also been high. Some studies from South Asia have shown that probably vitamin D is also linked to mortality or death rate. So it is an emerging science. We don't have randomized controlled trials, we have observational studies, but there seems to be a role in vitamin D supplementation, prevention of COVID, and prevention of even worse outcomes after one gets COVID infection.
So therefore, what Rajiv has told is very clear कि अगर आपके शरीर में विटामिन डी की डेफिशिएंसी है, more chances of getting a COVID because it does cause respiratory protection, more chances of developing a serious COVID, and more chances of ending into a complications in a serious COVID. So therefore, the aim is to build up your vitamin status, specifically vitamin D. Everybody is talking about zinc. Everybody is talking about folic acid. Everybody is talking about B12, calcium. All of them we do get from supplements or from the diet, specifically if you have a sprouted diet. But vitamin D is very, very difficult to cover it up from the diet alone, because in India, very few fortified vitamin is just vitamin D has just started, but it doesn't cover. So therefore, you end up taking into a supplement. Are you taking a supplement?
Yes, I'm taking a supplement of vitamin D. I'm taking 2000 units per day so that my reserves are pretty okay. And that is what I would recommend everyone, because vitamin D has a longer half life. It's around 14 to 15 days. So data suggests that daily is better as compared to monthly, but supplementation is required, and that will help us to prevent any kind of infections. And overall, immunity and hygiene are going to be the biggest talking points in the next year or two. people are going to shift towards improving their immunity and improving hygiene. And there, COVID-19 and multiple other illnesses will come in, and people will invest on their own health, because we believe that health is wealth, and prevention of a problem is much cheaper than treating the problem.
If
Yes,
you
sir.
have a small intestinal inflammatory disease or a small intestinal dysfunction, your requirement may be just the double. And
Right.
because vitamin D absorption, and in this particular condition, COVID-19, small intestinal absorption is delayed.
Right.
Is because it is basically a COVID gastroenteritis. It
Mhm.
causes nausea, vomiting.
Mhm.
COVID virus may be seen much earlier than the virus in the throat or in the lungs. And
Mhm.
sometimes you have up to 3 months, the COVID antigen may be positive in the stool when it is negative in the respiratory tract. So
True.
COVID gastroenteritis does lead to deficiencies of all vitamins, including vitamin D. Therefore, some people postulate that in the initial COVID phase of the treatment, you may have to give higher dose of vitamin D for the first 3 days, and then you can continue it for a longer period of time. That means that's what many people propose as a protocol, that you give a high dose multivitamins, not only vitamin D, but also zinc at a higher dose, vitamin C at a high dose, because it is predominantly a small intestinal disorder. It causes appendicitis-like picture. It causes mesenteric adenopathy, mesenteritis. It causes hepatitis. It causes cholecystitis, gastritis, esophagitis, acid reflux. So, in fact, some people say this is a respiratory GI problem, that predominantly it involves the respiratory tract and the GI problem. Therefore, make sure that your patient is not deficient, even if the patient is having a normal level of, normally we say, if it is not in the double digits, if it is not in the make it in the double digits, that means even more than 10, more than 20. But in a COVID time, it is better to keep it on the higher level of the upper normal. Am I right?
You're absolutely right, sir. And those are really pearls of wisdom to people who are watching. My only addition to that is that a lot of people are scared to go to laboratories to get them checked. So supplementing 2,000 units per day, or 30 to 60,000 units in a month, you may not require to go and check also. And if you check and you find it is undetectable, then you may have to go on a higher supplement. But if you're not able to check, taking 2,000 units per day, you're not going to go into a vitamin D toxicity. And again, as sir said, that there are prospective studies being done where higher dose of vitamin 3 are there, where higher dose of vitamin D on admission with COVID has been shown to reduce outcomes, and that itself will set the ball rolling for COVID-19 and vitamin D interaction and the connection between the two.
So vitamin D deficiency is common in India. Vitamin D deficiency is linked with worse outcome for respiratory infections, and COVID-19 is a respiratory infection. And GI absorption, if delayed, can impair your absorption of vitamin D. We have talked about two important things. A, vitamin D deficiency is linked with respiratory disorders. B, vitamin D deficiency is linked with COVID-19 seriousness. C, because of small intestinal involvement in COVID-19, in the initial phase of the disease, we need to give high dose vitamin D. Coming back to the seriousness, we all know that COVID-19 is serious in the first 9 days. After 9 days, the virus is non-replicable. Day 3, day 4, day 5, day 6 are serious situations where a patient can develop pneumonia. Therefore, we always say do 6-minute walk test on day 1, day 2, day 3, day 4, day 5, and day 6. In many cases, it is difficult to decide which is day 1 and day 3. Therefore, the day you get symptom, start your vitamin supplementation, including vitamin D. Now, coming back to vitamin D role in pregnancy, in newborn, and elderly, and children. Request Dr. Rajiv to slightly
So,
elaborate.
Vitamin D deficiency is very much common in the pregnant individuals, and congenital hypocalcemia, where children are born with lower calcium and sometimes they go into seizure activity with low calcium, has been seen in patients of mothers who are vitamin D deficient. So, supplementation of vitamin D and calcium rich food in pregnancy is extremely important, and it can have long term dividends on the baby and on the offspring over a long term period. So it is something that the fortification of food, supplementation of food during pregnancy and in the pediatric age groups can prevent not only rickets and osteomalacia, but also build up immunity in the baby to start off, and also immunity in the mother to prevent long term complications.
So what about when we talk about elderly specifically, because
So,
comorbid
so, so,
conditions,
so,
diabetics and other things.
so vitamin D is a supplement which has different connotations based on the gender, on the age, and on the comorbid conditions. So diabetes also, there's a lot of link towards insulin resistance and vitamin D. Elderly patients are frail, their bones are weaker, they are prone to infections, especially now we have seen that the pandemic actually affects the elderlies. It affects patients with comorbid conditions with cardiovascular disease. It affects patients with type 2 diabetes. So the elderly supplementation with vitamin D during this pandemic and during this situation would really benefit in prevention of COVID, and also give them an overall sense of well-being and a sort of nurture towards a good immunity. And this in the long term will help. So supplementing the elderlies with at least 2 to 3,000 units per day is vital during this period, I would say.
What about the newborn at birth? 400 IU per day, or
400 IU per day is the recommendations for newborn at birth, so that should be more than sufficient, I would say.
so you continue your vitamin D supplementation in the first 6 months of the birth.
Yes, you continue that. Yeah.
So therefore, whether you are from birth, I say even before birth, during pregnancy, till the last breath, vitamin D plays a role. Most of the time we talk about vitamin D only for bone, but the non bone manifestations are much more important. What about the role of vitamin D in tackling any infection, including sepsis, viral? You have already talked about.
So, vitamin D is becoming a huge player, a huge fulcrum as far as infection and inflammation has come in. And its importance came in around the avian flu time, which is around 2005, 2006, where it showed viral replication coming lower around when you are given vitamin D supplementation. And especially with acute respiratory infections, there is a huge role of vitamin D. And secondly, in patients who are a little immunodeficient, like our type 2 diabetic population, our population who is post cancer, post organ transplant, patients who have undergone chemotherapy, these are patients who are at very, very high risk for infections. And these are the patients who ideally everyone across the board should have vitamin D supplementation. But these are patients who, if they get COVID-19, are at much higher chances of getting complications. And these people should be supplemented early. And that is what I would recommend across to people who are there. I am again saying it is not a magic bullet. Don't consider that if you take vitamin D, nothing will happen to you, but it will build up your nutrition. It will build up your support system. It will build up your immunity. It will reduce the inflammation caused by infection. That means the outcomes will be much, much better when you are on vitamin D supplementation.
So vitamin D supplementation is an adjunct to masking and social distancing. It's not a replacement,
Absolutely.
but definitely it may help. If you get this disease, the virus may behave differently. You may end up into a mild disease. Your complications may be less. The most important thing about this virus is this virus causes acute, manageable, inflammatory disease triggered by the virus antigen. Therefore, it is immunoinflammatory. People who have low dose, low degree of inflammation in their body, present with a CRP level between 1 and 3, which we call them as high sensitivity CRP, which makes people prone to get blockages in the heart. There, this virus can intensify their inflammation, leading to cytokine crisis. Therefore, we say all those patients where high CRP can be dangerous to them in precipitation of heart attack are the high comorbid situations. Any drug which is anti-inflammatory has a special role as far as COVID-19 is concerned. So its anti-inflammatory action plays a very important role. In Ayurveda, we say Agni. We say Sam dosha, Sam dhatu, Sam Agni malakriya. That means you need to balance your Agni in the body where it plays a lot of role. Does this vitamin D has any role in regulation of microbiome in my body?
Yes, vitamin D has a huge role in the microbiome in the body, and as you were talking about this cytokine storm, that seems to be the trigger towards acute respiratory distress syndrome, or the whole process by which the whole lung is destroyed by the fourth or fifth day. And people who have been vitamin D sufficient have been found to have lesser cytokine storm as compared to patients who are vitamin D insufficient. And there seems to be a whole huge role of vitamin D inside the cell, and also in mediation of inflammatory responses. And majority of this is an inflammatory response. And COVID has an immuno-evasive method of entering the body, and also kind of evasing a lot of immunity triggers. So it is almost like a guerrilla warfare which is occurring inside our body. And supplementation from all these micronutrients, including zinc and vitamin C and vitamin D, will play a huge role in preventing the progression of the cytokine storm.
So before I end, because it's the time is short, can I ask you to give me 3 or 4 takeaway messages?
My first takeaway message to everyone who's listening is that immunity and hygiene are going to be a huge role to play in the next coming 1 or 2 years. So social distancing, masking is going to continue. Secondly, people will invest more on their health because they have realized if you are healthy, you do not require complication. You will not get complications. Secondly, getting a good lifestyle and improving immunity with the help of supplementations, which could be vitamin D, vitamin C, and eating a fortified food, which also has a lot of calcium in the body, would help in the long term prevention of complications and respiratory illnesses like this, and would help in the whole country becoming healthy over a period of time.
So before I end and summarize, let me pick up few of the questions who have come. Thousands of people are watching this program, and they vitamin D and vitamin C बच्चों को दे सकते हैं. Yes, he has already
Yes.
said दे सकते हैं. And then the dose of D3 during COVID, I've already said. Some people give it 60,000 units daily for 3 days, followed by 60,000 units per week for 8 weeks, then 60,000 units per month. And dose in COVID illness, we have already talked about. Which form of vitamin D? I take the gelatin capsule because it's a fat soluble vitamin. So I take a gelatin base. Which forms gelatin base may be better than others. Calcium vitamin D के साथ में कितना लूं?
The recommendations are around 1,000 milligrams, but it also depends on what are the kind of foods you are taking. If you are rich in non-vegetarian food, if you are rich in pulses, if you are rich in egg yolk, maybe a little smaller amounts, but at least 1,000 milligrams of calcium should be supplemented.
मेरा कोविड का चौथा दिन है, मेरा विटामिन डी 14.2 है. I've already said take high dose vitamin D in the first 3 days and take the protocol
Yes.
with that. And after these questions, let me sum up from the Vedic knowledge. Lots of Upanishads, whether it is Surya Upanishad, whether it is Prashanna Upanishad, Bahidra, Aranyaka Upanishad, They all talk about Surya as the god, the sun is the god. Sunlight needs to be taken at least 3 times in a day. Sunlight needs to be taken at least 3 times in a day: morning sunrise, evening sunset, and in the afternoon. Unfortunately, people are not taking, therefore, customs came that 1 month of Magh ka Mahena followed by Magh Purnima, or Vaishak month followed by Vaishak Purnima, or Kartik month followed by Kartik Purnima. You take vitamin D every day for 40 days. Never happened. Chhat Puja came in North India, that in you start taking vitamin D in the evening also, but that has become only a ritual. The answer therefore is that we need to, by hook or by crook, we need to have vitamin D in our body. And therefore, till every food becomes fortified, vitamin D supplementation becomes very important in health and in disease, whether bone or a non-bone. It's now a metabolic disorder, specifically with insulin resistance, hyperinsulinemia, metabolic syndrome. If you want to prevent heart disease, the role of vitamin D is there. And in COVID, vitamin D plays a special role. On our request, the Alchem pharmaceutical, the Virgin Nova, we contacted them, and on our request, we requested them to flare up and to share this video all over the country to all the doctors and to the public at large, so that more and more number of people can get benefited. That's all for today. I thank Rajiv to be here with us.
Thank you so
And
much.
presenting his wonderful discussions with me. And for those who are present here, if you feel that this video makes some sense, it can save somebody's life, it can save somebody's disease, make somebody's disease milder, please share this video with others. That's all for today. Let me thank Rajiv to be here, and namaskar, Rajiv ji.
Thank you so much. Thank you very much.